We're going to talk today, let's go to the next slide, about what happens when you're told that you're going to be the new infection preventionist. And once you find out that that's your new role, what is that role? Maybe you've never been an infection preventionist before in any kind of clinical setting. Well, the role of the individual who is the infection preventionist is pretty broad, a lot of responsibility. You need to ensure that there's a written infection prevention and control program in place. It has to be in use and evaluated on an annual basis. We'll talk more about that next session when we talk about the actual infection prevention and control program. You need to ensure that you have the policies and procedures in place that are needed for the infection prevention program. They need to be written and they need to be known by others in the facility so that everyone is following the same policies and procedures. You have to collect surveillance information on infections, identify trends. If there's an outbreak, you need to identify it early, figure out how to mitigate it. If you are unsure of what to do and how to do it, reach out to your county health department or your state infection preventionists. There are state infection preventionists in Nevada, and they're a great resource. They are not the surveyors. They are infection prevention experts who can help you and tell you exactly what you need to have in place in the state of Nevada to be in compliance. Then if you work in a nursing home, skilled nursing facility, you need to have an antibiotic stewardship program that is conducted in conjunction with your pharmacist or your pharmacy consultant to track the antibiotic use and make sure antibiotics are not being overused and that they're being administered for the correct purpose and the correct dose for the correct length of time. And the pharmacist is the person who will really create that program with you. And you also have to educate staff on infection prevention and control practices. And for those facilities that are skilled nursing facilities, CMS is expecting you to do this. And if they send in surveyors and they find that your staff are not aware of what the infection control, prevention and control practices are, they can give you a tag for that. So make sure that you have that covered as well. Let's go to the next slide. Okay, so now you've been told you're going to be the new infection preventionist and you're thinking, oh gosh, why me? But maybe you're the person it just defaults to, or maybe the director of nursing or the administrator really thinks that you have the skills and ability to do this. But the question is, do you have the qualifications and are you up for the challenge? If you really need to evaluate yourself and what kind of previous education have you had in infection prevention? Have you gone to in-services? Have you ever worked in infection prevention and control? Have you ever participated in auditing activities with an infection preventionist? Have you ever had a mentor who helped you with infection prevention? Where are you on the continuum of knowledge on infection prevention and control? Now, the assumption I'm making here, and I'm just being very honest about this, is that I am making the assumption that you have no experience or no education or experience in infection prevention. So that being said, if you're now in the role, even as an interim, you need to start infection prevention education as soon as possible. So you think, oh, great, well, how do I do that? Where do I start? Well, one opportunity that is available through the CDC, Centers for Disease Control and Prevention, and Centers for Medicare and Medicaid, they put together a 23-module education program that is online. The modules and submodules, they can be taken in any order. And it's online, it's free, and it's designed for nursing home infection preventionists. But the theory is the same for any facility or level of care that you are providing. So what you learn in these particular modules will transfer to assisted living, to group homes. The only thing that you wouldn't have to do is an antibiotic stewardship program, except in nursing homes. So the information is very good. Now, that being said, if you start taking these modules and you find that they're too much, that they're just too difficult for you, which could be the case, then consider going to Project First Line and looking at their videos. They have excellent videos. They're all pretty short, and you can actually complete them and get a certificate of completion from Project First Line. And Project First Line is created and produced by CMS. So that will also give you proof to the surveyors that you do have education in the area of infection prevention and control. And then if you take the CDC CMS online program, the 23 modules, when you complete all 23 modules, you take a post-test. You have to get a 70% to pass. I believe you can take it several times if you don't pass the first time. It's not considered certification, but it is a certificate of completion that you obtain, and it is acceptable for the purpose of getting surveyed and showing that you have done that. So if all of a sudden you're put in this position, start working on these education modules as quickly as possible, or the Project First Line. So if you are in your window for survey, you will be assured that you won't get a tag for not having appropriate education. Let's go to the next slide. Okay, so this infection preventionist training course, as I said, it's designed specifically for nursing homes, but it can be used everywhere. The content is applicable to all long-term or congregate living settings. As I said, it's 23 modules, and it also introduces infection prevention and control practices to reduce pathogen transmission, healthcare-associated infections, and antibiotic resistance. And so the pathogen transmission, mitigating that, and the healthcare associated infections are all very appropriate to other settings besides skilled nursing. And as I said, the best part is it is free. I have completed it. I did it about a year ago. It was okay. I would probably rate it a 3 to 4 out of a scale of 5 stars as far as being interesting, but it is comprehensive. Let's go to the next slide. So the question then becomes, well, what if you're here and you're taking this class and you're saying, but Jean, you keep talking about nursing homes. I don't work in a nursing home. I run an assisted living facility or residential care, or I work in a group home. So what about us? Well, you don't have a mandate to have a designated infection preventionist, but it is highly recommended. And we know that infection prevention and control practices are just as important in your settings as any other settings. They're important in the home setting, in hospice. It's important, even in your own home with your own families. So how do you obtain the information that you need to prevent infections from spreading between your residents, clients, or your staff? And as I said, those modules from CDC and CMS are a good place to start. Project First Line videos are also a good place to start. And I will also mention the Project First Line videos that have to do with environment and air circulation are excellent, 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 very informative. I've watched many of them and just think they're excellent. That's all I can say about them. And of course, participate in this ECHO program, because we try to give you the information that we think you need and also the information that you tell us you would like to have. Let's go to the next slide. Okay, so in the state of Nevada, there is guidance for group homes and assisted living and residential care facilities. This comes from the Nevada Division of Public and Behavioral Health, and I think are excellent resources. And this is a direct quote from them. Because group homes involve different individuals living together and sharing activities in congregate living settings, group homes are at high risk of COVID-19 spreading and affecting their residents as well as staff. Oops. Having an infection prevention and control plan individualized to your facility is important for the protection of your staff and your patients or residents or whatever you call the people you're providing care to. The generic infection prevention and control plan, which is linked below in that first reference, is available for you. And for group homes, it's meant to assist each facility in developing its own individualized plan to meet the need of the facility, its residents, and staff. So these are two excellent resources that you can use, and then take the plan and individualize it for your particular setting. So great resources. Think about this when you're putting together your infection prevention plan in your non-nursing home setting. Great advice, I think. Okay, let's go to the next slide. Okay, so what else can you do? Well, join a local infection prevention and control group. Find out if there is one. You can do that by calling the local infection preventionist in your acute care hospital and find out, is there an IPC group somewhere? Find a mentor from the group who agrees to answer your questions. You really are going to need somebody that you can count on to answer your questions quickly and effectively and correctly. If you can't find a mentor in the local area, you could consider joining a professional group such as the Association of Professionals in Infection Control and Epidemiology. That's APEC. It's an international group based in America, but if you join it and are a member, you can reach out and ask questions of lots of people who are members. And then they also have local and regional chapters. There is one in Southern Nevada. For Northern Nevada, we're part of the Intermountain group, I think, but they're a pretty active group as well. And you can reach out to them, participate in their education activities, and get involved with them so that you know them, they know you, and you have colleagues that you can reach out to get assistance. And then get experience. I mean, we all had to start somewhere, right? I started in infection prevention in 2004 when I was chief nurse at a brand new surgery specialty hospital that had not opened up, and I had to develop a whole program. It was like, what am I going to do? How do I do this? So I learned this the hard way as well. I did join APEC. They gave me a mentor who actually was in Hawaii, and anytime I had specific questions about what I needed to do, specifically geared towards surgeries and surgical site infections, the individual was very, very helpful. So absolutely consider this. There is a cost involved for membership, but if you're serious about being involved in infection prevention and maybe shifting into that as a career, that's a good place to start. And get that experience, get a year or two of experience, and then consider taking a national certification exam. And we're going to be doing some work on that next year in Nevada. So stay tuned for that if you're interested in becoming certified. More to come in the future with information about that. And then contact us. We're here. We are specifically expected to provide consultation. We do not charge. We're funded through the state of Nevada through a CDC grant. And regardless of what kind of a setting, if you're home care, hospice, we have resources that can help you and individuals who can help you. I have a master's in community health nursing. I have done a lot of home visits. I've worked in home health. I also have worked as a nurse practitioner in hospice. So there's very little out there in the community as far as clinical that I haven't experienced myself and worked in those settings as well. So lots of resources. We also have a couple of other infection preventionists on our team who, if I cannot help with a specific question, I reach out to Debbie Hurst, who is on staff right now, and we have another infection preventionist joining us next month who will be in Utah. So we have resources. Let's go to the next slide. Okay, so the coaching and consultation framework that we offer, it's virtual or it can be on site. One-to-one consultation. We tailor it to your needs and your setting. And the core components include, initially we do an introduction and program assessment. So if you need help evaluating your infection prevention program, for example, we will do a risk assessment, we'll do an evaluation of your current program, identify where you could strengthen the program and assist you with that. Then we can do an environmental assessment and walkthrough, evaluating your IPC infrastructure, identify resources and your supply needs. If we can't do that in person, we can do that virtually. Then we monitor and follow up on your performance and assess your progress. We give you tips on how you can continue to improve, because the whole goal here is get your program to a position where it is sustainable. So if something happened, you had to go to the hospital and have your appendix out today, somebody else could pick up the program and figure out what to do until you come back. So, and we're here to help any way we can on that. And then quality assurance, assess the uptake and sustainability of our recommendations and see if the recommendations actually work for you and for your setting. Let's go to the next slide.